Assalamu alaikum wa rahmatullahi wa barakatuh. Our topic today is about hyponatremia symptoms and signs. Hyponatremia is associated with a decrease of the osmotic pressure of the extracellular fluid. There is a tendency in such condition for water to move from the exterior of the cells to inside the cells, inducing cell swelling. The most affected organ is the brain, specifically the astrocytes, which constitutes a very important part of the blood-brain barrier, becomes swollen. And most, if not all, of the manifestations of the hyponatremia is due to brain edema. And actually cases with severe brain edema in such a condition can have mortality up to 34%. Now, the presentation of the hyponatremia depends on the acuteness of its development and the magnitude of drop of the serum sodium. If the serum sodium in acute condition in which it is developing over less than 48 hours is less than 135, but still above 125 millimole per liter, the patient will have nausea and we will have malaise. With more severe degree with sodium between 125 down to 115 millimole per liter, there will be restlessness and there will be obtundation, confusion. In severe cases with sodium less than 115 millimole per liter, seizures and coma will happen, and the respiratory arrest can happen secondary to brain herniation. In chronic hyponatremia, which develops in more than 48 hours, there is time for adaptive mechanism within the brain to minimize the brain cell swelling and to decrease the manifestation. What happens actually is that organic osmolytes inside the astrocytes, which is affected mainly by the hyponatremia, start to migrate out of the cells. Along with it, sodium, potassium, and chloride will be moving out of the cells to the outside, dragging water out with them, decreasing the cell swelling. But such adaptive mechanism needs time to develop. That's why in chronic conditions, symptoms will be less. In acute hyponatremia, there is no time for adaptation, and that's why brain swelling or brain edema will rapidly occur with all the severe manifestation, which can be fatal. Now, what about the signs of hyponatremia? Signs are divided into two categories. The first is related to the cause of hyponatremia. As we have said before, that group of causes include all hypovolemia causes, like repeated vomiting, diarrhea, cases of overdiuresis with use of diuretics, and such a condition will find signs of dehydration and hypovolemia with low blood pressure, with dryness of the mucous membranes, while the other group associated with hypervolemia as in congestive heart failure and liver cirrhosis and nephrotic syndrome will find the signs of hypervolemia like congested veins, edema of the lower limbs, crackles at the lung basis if pulmonary edema is present. The other category of signs are related to the hyponatremia itself. These are signs of what we call the hyponatremic encephalopathy, which will include disturbed consciousness with varying degrees increasing with the severity of the hyponatremia, hyporeflexia, seizures, and coma. This will cover most of the symptoms and the signs of hyponatremia. Our next lecture will be about the approach to diagnosis of hyponatremia, differentiating its different causes as a necessary step for its treatment. I hope you will be following for the next lecture, and thank you for your attention.